Welcome to On Track. I'm Aisha Jaffer. It's back to school time across the region, and while many families are focused on supplies and schedules, one of the most important things to check off the list is making sure your student stays healthy. The CDC is reporting spikes in preventable diseases like measles and hand, foot, and mouth disease, and we're still seeing COVID surges in some areas. So what should families be doing now to keep kids healthy and safe during the school year? Joining us is Dr. Eva Stone, and manager of District Health Services for Jefferson County Public Schools, to talk about vaccinations, illness prevention, and building healthy habits for 2025 and beyond. Dr. Stone, thanks for being here on Track today.
You're welcome. Thanks for having me.
So just to have a baseline, what vaccinations are students required to have to attend Jefferson County Public Schools?
So all routine childhood vaccinations are required to attend school. So that's things like measles, mumps, rubella. Please make sure your kids have their measles, mumps, rubella vaccines. That's tetanus. That's pertussis or whooping cough. That's hepatitis. That's there's another vaccine, Hib, which is a type of influenza. Polio. All those childhood illnesses that we haven't seen for several years, we've got great vaccinations for. And so making sure that your child has their routine vaccinations from their healthcare provider is just incredibly important. By middle school and high school, a meningitis vaccine is one that's added to that list as well.
So is that pretty standard across the board for public schools?
Yes. So in Kentucky, and every state has their immunization requirements. So yes, every school district has the same requirements across the state for vaccinations.
And are any of those requirements changing this year, or do you see any shifting in the near future?
No. They're standard vaccination requirements we've seen for years.
So rising measles cases have made national headlines, with a few cases here in Louisville. What do families in our region need to know about this illness, and how can they make sure their student and really their family is protected?
Measles is very significant. And so, again, the best thing we can do to prevent measles is ensure that your child is up to date on their vaccinations. And that is critical because not only can measles make children very, very sick, it's also very, very contagious, which is why we worry so much about it in the schools. Measles floats in the air. It hangs in the air for up to 2 hours after somebody who's had measles has been in a room. And that just makes it very infectious. If your child's not vaccinated, if you're not immunized, the risk of getting measles if you're exposed to it is very high. And what's important for parents to know as well is that if your child is exposed to measles and they don't go get vaccinated at that point, if they haven't had the vaccine, they can be out of school for 21 days. And so that is so disruptive to their learning, but it's disruptive to family life as well. And so, again, prevention is the way to avoid this. Please get your vaccinations.
So then if the family themselves is not vaccinated, they're not vaccinated, then they could also get it too, so it could spread to the family.
Exactly.
Yeah. 2 hours in the air.
Exactly. Yes.
That's pretty wild. I did not know that. If a child isn't yet vaccinated for measles now, what should parents and caregivers do? Is it too late to get the shot at a certain point, or?
It is not too late at all. And so please see your healthcare provider. And, a lot of families have health insurance. They have a healthcare provider. Please make sure you have arrangements to get those vaccinations, those routine child immunizations done. If you don't have health insurance, if you don't have a medical provider, we have systems in place now in JCPS where we can provide those routine childhood vaccinations. We've got 2 clinics in the city where families can make appointments and bring their children for those immunizations. And we have nurse practitioners in the district who travel to schools. They do clinics at school, and you can talk to your school nurse about getting that arranged. And we also hold clinics in all of our schools. Again, immunization clinics, providing those resources on site. We know parents may not have insurance again. They may not have a healthcare provider. They may not be able to leave work when most clinics are open Monday through Friday, 8 to 4:30. But your child is at school, and so school is a great place to have those services done, and we want to make them available for families.
And you said JCPS has 2 clinics itself?
Yes. So we have a clinic at CB Young Service Center on Crittenden Drive, and we have a clinic at the South Central Neighborhood Place. And so all parents need to do is call our office, and that's at 485-3387. They can schedule an appointment to have their children seen at that clinic, not only for routine childhood immunizations, we do free physical exams as well.
Wow, that's a good resource to have. So we talked about this in the intro a little bit, but the CDC says COVID numbers are rising nationally. With the school year just getting underway, how is JCPS prepared to handle potential cases or outbreaks?
So I have good news and bad news on that front. So the bad news is up until June of this past year, we were able to get free COVID tests from the government. They're not providing those for us anymore. The last couple of years, they've come directly from the federal government. We won't have that resource. And so that's a step backwards. That's a challenge for us because that really was a helpful tool for us to help families and support families and identify cases of COVID early to help protect others. But the good news is we have an electronic health record in the district now. And why does that matter? Well, it's a health record, and we have the ability to monitor illness rates across the district. So, of course, we have school nurses at all of our schools, very significant because the nurses can see the sick students, help identify what's going on. Kids who are sick that shouldn't be at school, they can work to get those kids excluded from schools and away from the others. The electronic health record lets our epidemiologist in our office monitor for symptoms, monitor for illness, and then help us to respond quickly when there's cases of illness in the school. But the other thing I would urge parents to do is to get that flu vaccine for your children. It's that time of year. Last year, we had a lot of flu in the city. And a lot of kids missed school, a lot of families that disrupted your routine. And again, the best way to prevent that from happening is to get that annual flu vaccine.
I remember that surge of
Yes.
flu. I definitely got hit with that surge of flu.
Yeah, I remember it well too, yes.
Oh my goodness. Well, so it sounds like it's kind of like a tracking, right? So they can track what's going on as
Yes.
far as
Yes.
illnesses, which is really cool to say. And then so you mentioned the flu, and I have to ask because you said this is the time of the year. Like I was kind of curious, like when is the best time to get your flu shots, and why is it important for school health?
So fall is the best time to get that flu vaccine. Typically, late August, September, early October is the best time to make sure that you have coverage during that peak flu season. So we'll be doing clinics across the city in partnership with some pharmacies for our staff. We make flu vaccine available for students through our clinics as well. So again, parents, if you don't have insurance, don't have a resource for that, we can help you with that to make sure that your child has the flu vaccine.
I want to bring it back real quick to COVID too, though. If a student tests positive for COVID, are there still any measures or practices in place in schools to help reduce that spread? You know, like we had the masking for a certain amount of time, things like that. I'm just curious.
Yeah, so let me say a couple things. One is what I didn't mention about COVID is that Louisville is one of the sites across the country that does wastewater monitoring for certain viruses, COVID being one of them. And so really props to U of L and their Envirom Center because they partner wonderfully with us to help monitor for illnesses in the wastewater. And so like right now, we know that we're having a bit of a surge for COVID in the city. So everybody needs to know that. And the northeastern part of Louisville is showing the highest activity right now. And so that wastewater monitoring helps us kind of get ahead of things. So the measles are things we look at in the wastewater, lots of viruses and illnesses to help us prepare, remind schools about ways to help prevent the spread of infections in the schools, and so on. So it takes a village, takes all of us working together to do this. So as far as the schools go and prevention of COVID, it's that monitoring that's so important. And so our school nurses, parents, if your child's sick, make sure they're not calling you directly from the classroom. We want the school nurse to see them so we can help monitor for illness in the school and also so we can get them routed to the right spot. And then those reminders, the hand washing. Please don't send your kids to school when they're sick because it makes other people sick. And we need our teachers and our school staff to be at school. We don't need them to be unwell. But if a child is positive for COVID, there are still measures in place, and same for adults. And that is you should not be around other people until you're symptom-free, you're fever-free for 24 hours with no fever-reducing medicines, and your symptoms are improving. And so if you remember, that used to be an automatic 10 days early on in COVID. It's not anymore. It's if I am positive on Monday and by Wednesday my symptoms are better, I haven't had a fever for 24 hours, then I can be around other people, but I need to mask for 5 days after that. And so we have those same measures in place in the schools.
I'm curious, too. I'm coming back to the water testing.
Mm-hmm.
That is such a fascinating way to monitor this kind of situation. How did that partnership come about?
Again, big props to U of L. They came to us, and they have done just an amazing job working with us and with Louisville Metro Public Health to say, what are the important things from a public health perspective, from a safety perspective for the city that we need to be monitoring for? And so they send us weekly updates based on that panel. There's different watersheds from around the city where they do the wastewater testing, but really gives us an indication, again, of what we're starting to see in the city so we can prepare for that. We can prepare our school nurses. We can prepare the schools, send out those very important reminders. So, yes, the wastewater monitoring is very helpful in helping to monitor for illnesses.
Well, another virus on the rise is hand, foot, and mouth disease. What should parents and caregivers know about it, its symptoms, how it spreads, and the best ways to prevent it?
So hand, foot, and mouth disease, a common childhood illness. And as a parent, if you've seen your child have it, it's awful to watch them because literally they get blisters in their mouth, in their throat, hands and feet. It makes it painful to eat and swallow. They run a fever. Hand, foot, and mouth disease is one of those things that kids are often infectious right before they start having symptoms. And so it's hard from a prevention perspective. What I would tell parents, don't send your child to school if they have a fever, which is defined as 100.4, temperature of 100.4 or above. Reminding kids to wash their hands often. Our early childhood programs are very great about, wiping down toys, wiping down tables, and that's how you prevent it. It's droplet, and so it's hard to get a handle though on once it's spreading. And what's happened across the country has been unusual for pediatricians to see the volume of cases that they're seeing of hand, foot, and mouth right now.
So it's about cleaning things that are
it's
tactile.
About cleaning things that are tactile, those surfaces. Hand washing. I can't emphasize enough the importance of washing hands.
Yeah. Choose the 20-second song, right?
That's right. I sing the ABC song with my grandson. He's very good about it.
Oh, I love that so much. Are there other diseases or viruses your district is keeping an eye on right now because of recent upticks in the region?
Well, we keep an eye
on everything.
So we keep an eye for everything. We've got a great working relationship with Louisville Metro Public Health. And so there are illnesses that are reportable by law. And so what happens is when there's cases of things, we work back and forth with each other. So we've seen several cases of whooping cough. Last year, we saw several cases of chickenpox last year. So those are out and about. Again, vaccine preventable. And even if your child's been vaccinated, remember, they can get it, but they tend to have a much milder case. And so just really important to watch for those things. And every now and again, we get an outlier, an illness that we don't see very much of. But most commonly, we've seen whooping cough and chickenpox.
Yeah, I know. And there's been other kind of like diseases talked about in the news, but those haven't been human transmission as much, like bird flu.
Exactly. Yeah.
Well, we'll be back with more in just a minute. You're on track with Louisville Public Media. Welcome back to On Track. I'm Aisha Jaffer, and we are talking to Dr. Eva Stone, Manager of District Health Services for Jefferson County Public Schools, about how to keep your kids healthy as the new school year gets underway. So what ultimately is the best way to keep kids safe this school year from all of the illnesses we're talking about, like the flu, COVID, measles?
The very first thing is the recommendation for children is they have an annual physical. They have a physical every year. You see your healthcare provider. Those are very important to have. You want your kids to do well in school. You want them to succeed academically. Sometimes things are going on that you really may not notice, but when they have that physical, that a healthcare provider will pick up on them. And I strongly encourage parents to make sure you're having that done. Vision screening, hearing screening, all those things are really important to help your kids. You need to make sure your kids are getting enough sleep at night. Kids at the elementary and early, kids before middle school should have 8 to 10 hours of sleep a night. And then it's not much different by the time they get to high school. And so you've got to make sure your kids are sleeping. Sleep is so important. It's important for their mental function. It's important for them to do well in school. Get those phones and those devices away from them before bedtime. Take away those things that will disrupt them from going to sleep and staying asleep, because that is critically important. Making sure they're eating well, that they're eating, healthy foods and not just snacking on junk, which is what we all want to do. But that they get nutritious meals at schools. And they can have their breakfast and lunch at school. So make sure, if they're not ones that want to eat straightway when they get up in the morning, make sure they're eating at school, but make sure that they're getting enough fuel, they're drinking enough water. And again, those routine childhood vaccinations, I can't emphasize that enough. And if you have questions about vaccines, things that you're just not sure about, if you're uncomfortable, there's a lot of misinformation out there about routine childhood immunizations. Talk to your school nurse, talk to your healthcare provider, talk to a health professional who can really help talk you through what those vaccines do, how they work, but get those questions answered. Don't just not have your child vaccinated.
I mean, that's something I was going to ask when it comes to vaccine hesitancy. How does the district address these concerns from families?
So we really want to work with families. And I've been asked, okay, these kids aren't up to date on their immunizations. Why don't you just put them out of school? Well, if we put kids out of school when we don't understand what the reason is they're not having these routine immunizations, the question is why. If we put them out of school, we're putting them at a disadvantage academically. So very important for parents to know, if your child misses more than 5 days of school in an entire school year, that puts them at risk academically. So sending your kids to school every day is really, really important. And so if you have questions about vaccines, if you're not having your child immunized because of questions that you have, is to make sure to get those questions answered. We will work with you. We will talk with you. We will help just encourage you to get to where you feel comfortable and get your questions answered and making that informed decision as the parent of your child.
Is there a specific resource or place they should go to get those answers?
To their school nurse, to their healthcare provider. We've got information on our district website. Go to the Centers for Disease Control website. Again, research is clear. Don't get your information from social media. Get your information from health professionals, from websites. If you're going to the internet, make sure that it is a trusted resource that you're looking at. Look at the CDC. Look at the American Academy of Pediatrics, has incredible information for parents. But look at those resources that will really, that are informed, that are science-based, and will help you make educated and informed decisions.
So outside of vaccinations, what are the top ways families can help keep kids healthy throughout the school year? I know you mentioned sleep and healthy diet. Is there anything else?
Exercise. Make sure that they are physically active. They're not just laying around. All those things that kids need. Talking to your children. Ask them how their school day is going. In our household, when our kids were little, we ate dinner together as a family because we were able to do that, and that gave us an opportunity to spend time together, but also to learn from each other about how our day was. If you can't do dinner, then just find a time where you can sit down together with your kids, but stay connected with them. Ask how their day is going. It's really important for kids to be connected in school. So help them to find activities or things that they can do to feel that connection in school. If you have concerns about your child in school, talk to the school counselor. Talk to the mental health practitioner at the school. JCPS has lots of resources for parents and want to help support families for their kids to do well.
Yeah, and you make a good point, because mental health is part of overall wellness. How can parents and caregivers and school work together to support students' mental health? It sounds like there's some resources.
Absolutely. I really want to emphasize that at the foundational level, those things like making sure they're getting enough sleep, that they're eating decently, decently healthy food, that's important for your child's mental health. Limiting their screen time, their phone time. JCPS has a new cell phone policy this year. There's a reason for that. These are things that interfere with your kids doing well and can also interfere. There may be things going on that you're not aware of. And so being really connected in those things is incredibly important.
And so, there's so many things that we're piecing together that these for health, which I
Yes.
love, which I'm also like, I should do these things. I'm thinking about also just all the changes around us. Have there been any recent policy changes at the state or district level that have affected how schools approach student health and safety?
JCPS has done a lot regarding health, particularly since the pandemic. What the pandemic revealed for us, we were able to implement systems that let us look at things that maybe we hadn't looked at before. And so, now I spoke about the electronic health record, and I'm going to say how important that is. I want families to be so proud of JCPS for their work in this, because it has allowed us to interface with the state immunization registry. We can get your student vaccinations. We've had some recent changes to a policy around medications being given at school. And so the only change around that would relate to over-the-counter medicines. And so in the past, parents could send over-the-counter medicines just with a form filled out that they filled, and we're no longer allowed to accept those. We can accept them, but there has to be a signature from a healthcare provider. But, JCPS has committed a lot of resources. I'm just grateful, and I hope our families are grateful to understand what the district has done in moving to have nurses in every school, expanding the nurse practitioners that we have so that we can help support families for their children to be healthy. The mental health practitioners in school, that was a few years earlier, but that, again, health is so foundational that always have that on the forefront of everything when it comes to your children.
Yeah, you need to be healthy to be able to do most anything.
That's exactly right.
So it's interesting because you talked about this earlier in our conversation, all the resources that exist. And it makes me think about health equity issues in the school system, things like limited access to care, healthy food, or preventative service. Are there health equity issues you see in the school district?
So we have seen, and what I'm grateful for is that we can monitor for those and do something about it. So I'll use measles as an example. Because we have this electronic health record, because we can interface with the state immunization registry, we can look at immunization rates by school in a much more detailed way than we've been able to in the past. And so we don't want a measles outbreak in Louisville. And so, we want to look at by school, what are our schools where vaccination rates are lower, because what that tells me is those are kids who are not accessing the healthcare system on a regular basis. And so we triage, to use a medical term. We'll work with those schools with the greatest need first to try and ensure that there's access to those services. Adding the nurse practitioners, which our board committed to last year, helps us close the gap for those students who don't have access to have physical exams and, again, those routine childhood immunizations. Having the school nurses helps close those gaps as well.
That's wonderful to hear. But also, I am thinking, we're talking about health and the medical side, but also I'm thinking about, because we talked about these things about sleep and also
Yes.
access to good food. Is there any resources like that as well?
Absolutely. So we've got nutrition services, and so JCPS has free breakfast and free lunch for all students in the district. And so that is an amazing way to help, again, close that gap that exists and that's out there. Our schools have Family Resource Youth Service Centers, which is a state program. Most of our schools in the district have Friskies, as we call them, Frisky coordinators, and they're there to help meet those social needs that families may have. And so if you're a parent and you have food insecurity, that you don't have food on a regular basis, our Frisky coordinators can help with that. And they're very trusted folks who are there to help and support families. And then we've got resources for families who may be experiencing houselessness or have some other issues that are things that are happening in life where they may need some additional support.
So it sounds like the well-being of like the whole of any
Absolutely.
student is very
Yes.
much examined. So before we wrap up, if you could leave parents and caregivers with one or two takeaways really for keeping their kids healthy this school year, what would it be?
I know I'm repeating myself a lot, but you've got to make sure your child is up to date on their routine childhood immunizations. There's so much happening across the country right now with questions about vaccinations and the safety. I'm old enough to remember when we saw a lot more of these childhood illnesses, and the immunizations have changed the trajectory of kids living to be adults. And so it's okay to have questions about immunizations because there's so much misinformation out there. But I would tell parents, don't just sit on that. Find somebody who can help you get your questions answered and make an informed decision about the best care for your child. The other thing I would say is to be connected with your kids, to stay engaged in their life, to ask questions about their health. If you have questions or concern, talk to your school nurse, talk to your family resource center coordinator, talk to the school social worker or mental health practitioner or counselor, but let us help support your children to get through school, because their education is the single most important predictor of their health in the long run.
Well, Dr. Stone, thank you so much for being here on Track.
Thank you for having me.
Dr. Eva Stone is the manager of District Health Services for Jefferson County Public Schools. She holds a doctorate in nursing leadership from the University of Kentucky and is a nurse practitioner with decades of experience in nursing, public health, and systems leadership, with expertise in school health policy, infectious disease prevention, and community health initiatives. On Track is a production of Louisville Public Media. The On Track production team includes Michelle Tyreen Johnson, Alex Biscardi, and Laura Ellis. Our music is by Kojin Tashiru. If you'd like to revisit this episode or explore other community-focused conversations, visit LouisvilleOnTrack.org or find us in your podcast app. Have feedback or ideas for a future show? Connect with us at 502-814-TALK or ontrack@lpm.org. I'm Aisha Jaffer, and remember, being kind is free. That's the start of community. Until next time, you're on Track with Louisville Public Media.